Good morning. Thank you all so much for being here. We appreciate it. I am wearing silver today because it is our 25th anniversary. This is our 25th telehealth session for opioid use disorder safety bundle. So very exciting. And we couldn't have that been possible without your participation and attendance. So we so appreciate you being here. And we know that it's been extremely difficult, especially with COVID. So thank you for sharing your time with us. Our topic today, what we're seeing and what we get feedback from clinicians is when there is polysubstance use with your patients that they generally are also seeing sometimes challenges with tobacco cessation. So we have an expert today to share information about tobacco cessation resources. And then we will turn off the recording and just have a candid chat about how it's going, how you guys are doing, how we can help you. And I will share the bios of the esteemed people that we have today. So we have Sandra Schultheis. She is the Cessation Services Coordinator for the Tobacco Prevention and Control Program at the Utah Department of Health. She has a BS from Brigham Young University and an MS from the University of Utah. Sandra will be presenting information about free resources available through the Utah Tobacco Quit Line, which supports people wanting to quit all forms of tobacco. Information will also be presented regarding special cessation services for pregnant women. Sandra's worked in public health for 30 years. In addition to tobacco cessation, she has experience in epidemiology and promotion of healthy lifestyles. And then we will have the honor of being here with Janet Fisher. She is a recently retired nurse educator from the Labor and Delivery Unit at the University of Utah, who will be leading a discussion with hospitals about how they're doing on implementing the opioid substance use disorder safety bundle. For the past 27 years, she worked at the University of Utah Hospital. Janet has been integral to all the safety bundle work, including obstetric hemorrhage, severe hypertension and pregnancy, and obstetric care for women with opioid use disorder. We are grateful for her continuing to volunteer for the Utah Women's and Newborn Quality Collaborative to help improve health outcomes for babies and families statewide. So without further ado, I will turn the time over to Sandra.
Great, thanks so much for asking me to present today. So the services that I talk about will be exclusive to Utah, but all states have some sort of services for tobacco quit line. So for those of you from Wyoming, you can just Google Wyoming Tobacco Prevention and Control Program, and you can find all the resources that they offer. And basically, Wyoming has a lot of similar services to Utah because they use the same quit line vendor as Utah uses. So a lot of the things might be similar, but to get the specific details for Wyoming, you'll want to go to their website. So the Tobacco Prevention and Control Program exists so that we can reduce tobacco-related diseases and death in Utah. And we have a comprehensive program that focuses on preventing youth initiation of tobacco use, promote quitting among adults and youth, eliminate exposure to secondhand smoke, and identify and eliminate tobacco-related disparities. So how do we do this? So TPCP receives funds from the tobacco tax, master settlement agreement, and the CDC. We fund all 13 local health departments and 4 disparity networks, and that includes the Native American Network, African American Network, Polynesian Network, and Latino Network. And we also have a quit line and a comprehensive media campaign. We work with healthcare providers and health plans and local health departments to educate about cessation services. This slide shows how smoking can damage every part of the body. It can cause lots of different cancers as well as chronic diseases. And here's a quote by a former WHO director, and he said, "A cigarette is the only consumer product when used as directed kills its consumer." So that's really motivating to us to try to get people to quit. So here's the data that we have. And if you go to the website that's on the top of that slide, you can find all of the data that might be informational to you. And basically this slide's a little hard to see, but basically what these graphs are telling us is that smoking rates are going down and the vaping rates are going up. And so it's a really big concern for us on how to get people to not start vaping and how to get them to quit vaping. So this is what we know about vaping. E-liquids usually contain nicotine. Vaporizing devices have been used to vaporize other drugs such as marijuana or THC. Vaping reinforces the automatic habit of smoking and may hinder quitting because they keep, doing the same hand-mouth that they would do with smoking. Aside from nicotine, e-cigarette alcohol aerosol contains VOCs, cancer-causing chemicals, heavy metals, and ultrafine particles. Some e-liquids claiming nicotine-free still have nicotine in them. And we've done samples of e-liquids and found out that they really do have nicotine, even though they say they're 0% nicotine. Some modified devices have been shown to explode, cause fires, injuries, coma, and death. And the FDA has not approved these electronic cigarettes as a cessation device, even though some of the companies kind of try to say that they could help people quit smoking. They've not been approved for that. And we really don't see a lot of evidence that that could be true. So what the Tobacco Prevention and Control Program has done is we have this website that's all about vaping, and it's called seethroughthevape.org. And it talks about what is vaping, the dangers of vaping, help quitting, and helping your team quit. Vaping, I was going to talk about this on the last slide, but vaping products are also considered tobacco products. And in Utah, the Indoor Clean Air Act prohibits vaping in all the same places that smoking is prohibited. And so the cessation services that we offer help people quit all forms of tobacco, including vaping. So waytoquit.org is our one-stop shop for all things cessation. And there you can find information and free resources. And that there are lots of resources for those wanting to quit and those helping someone else quit. People can register for services that are provided through the Utah Tobacco Quit Line. And there's also a healthcare provider portal that we'll talk about in a minute, where you can refer your patients. So the Utah Tobacco Quit Line has been around for about 25 years. And if you call 1-800-QUIT-NOW, that's a national portal, and it will be routed to the area code for the phone that is calling that number. So if somebody has a Utah area code and they call 1-800-QUIT-NOW, they'll be connected to the Utah Quit Line. If somebody has a Wyoming area code and they call 1-800-QUIT-NOW, they'll be connected to the Wyoming Quit Line. So this has been really helpful for all the states. And when people move, sometimes that can be a little tricky because they might have an area code from another state than where they reside. But if they reach another quit line, that quit line can always transfer them to the correct quit line for them. So it's fine if that happens. So the quit line is free and confidential for Utah residents, and we pay for it with master settlement agreement funds. It's open 24/7 for inbound calls because they can take messages, recorded messages. It is available in English and Spanish, and they have translation services for all other languages. They can have a call with a coach from 7 a.m. to 11 p.m. They provide nicotine replacement therapy, which includes the patch, the gum, or the lozenge. And we have enhanced services for special populations, such as pregnant women, Native Americans, those with behavioral health conditions, youth, and young adults. So for adults, we provide 1 to 5 calls with the coach. It's 1 call for those that are insured and 5 calls for those who are Medicaid, Medicare, or uninsured. And we provide text messaging support for everyone. A My Quit Journey booklet can be provided to everyone. We provide 2 to 12 weeks of nicotine replacement therapy. So anybody can get 2 weeks of nicotine replacement therapy. And those who are insured and continue in the coaching calls can receive up to 12 weeks of NRT if they don't have any contraindications. And we have a special line for young adults, and they can text START to 36072, and they can have text interventions. So the coaches can text with them instead of calling on the phone. So for pregnant women, they can have up to 9 calls with a female coach, and that includes 5 during pregnancy and 4 postpartum. We have an incentive for them. It's a cash card for each completed call. So it's $10 for the first 5 calls and $20 for the remaining 4 calls. We find that if we can engage them postpartum, that they are much more successful in quitting for good. So that's why there's a higher incentive for the postpartum calls. They can get NRT with the doctor's approval. They get their own little booklet to help them quitting, and they can also receive text messaging support. So the youth program was just started in July of 2020, and we're really excited about this. We're hoping that we can get the word out to help these teens quit vaping. It was designed for youth aged 12 to 17 with input from the teens. They can either text or call, so they can have a text messaging session the same way the young adults do. And it will help them quit all forms of tobacco, including vaping. The coach will help them develop a quit plan and help them learn about nicotine and get individualized support. So we do a quit line evaluation every year. And since we've only had services with our current provider for 2 years, we finally got the first year of data, which shows that 30% of the phone coaching participants and 23% of the web participants quit using commercial tobacco. And so we're just really thrilled with these numbers, because when people try to quit on their own, they are only 7 to 9% successful. So it really does help to have an intervention.
Sandra, I have a question in the chat. So do you want me to go ahead and share it now or wait?
Oh, sure. If it applies now, that's fine.
Oh, sure. Okay. So the question is, and this is from Julie Northrup, she's asking, are the incentives the same for Medicaid or uninsured pregnant mothers? So I think it goes back to your the slide on the pregnant, that one. Yeah.
Sure. Yes, all pregnant women receive the same services regardless of insurance status. So thank you for that question. Yeah, so even insured women can get this, and we have enhanced services for Medicaid, Medicare, and uninsured. So for pregnant women, it doesn't matter. Everybody gets the same service.
Great, thank you so much.
Okay. Okay, we finished the evaluation. So now that you know how wonderful the quitting services are, I'm going to just talk a little bit about how you can help people quit tobacco. So these are the most effective resources for success: counseling, medication, and healthcare professionals. So healthcare professionals are really important, and we find that people will try a quit attempt more often if the healthcare professional advises them to quit. So it's really important, an important piece of the puzzle. So nicotine is a 2-part problem, psychological and behavioral. And we have medications to manage the psychological component and a behavior change program for the behavioral component. So treatment should address both pieces of the puzzle. So for the psychological component, we have 5 formulations of nicotine replacement therapy and 2 non-nicotine agents that have FDA approval as smoking cessation aids. And medications that are available without a prescription include nicotine gum, nicotine lozenge, nicotine transdermal patch, and medications available only with a prescription are the nicotine nasal spray, nicotine inhaler, sustained release bupropion, and varenicline. So, and also one formation of the patch is a generic transdermal patch, and that is also available through prescription. So the behavioral component, behavioral interventions have been shown to be very effective. So when a provider asks them if they use tobacco, advises them to quit, and connects them to services, that is considered the brief intervention. So first thing, you need to ask if they use tobacco, because if you don't ask, the answer is always no. And it's best practice to ask every patient about tobacco status at every visit. Are they current, former, or never users? And I know every time I go to the doctor, they always ask me that. And I'm always like, yes, they're doing what we're hoping they're doing. So it's also important to ask about all forms of tobacco. And this slide shows lots of different kinds of tobacco. So on the left side, it shows snuff and chew and cigarettes and hookah and little cigars and a tobacco pipe. On the right-hand side, it shows all the different, well, not all the different kinds, but some different kinds of vaping devices that you might see. So advising them to quit. So even brief advice to quit by a clinician results in greater quit rates. And smokers cite a clinician's advice to quit as an important motivator for attempting to stop smoking. So advice should be clear, strong, and personalized. So the website waytoquit.org has all the instructions on how to refer your patients to the quit line, and you can find that under the Healthcare Providers tab. And I think there's 3 sections when you go to the homepage, and it's the 3rd section down. If you just click on that, you can go to the Healthcare Providers section, and it will give you all the information you need on how to refer a patient and where the forms are and all that. So there are 3 ways to connect your patient to the quit line. The first way is fax referral, second way is online referral, and the third way is an electronic referral through your EHR. Now, the electronic referral through your EHR, what you'd have to do is computer programming to put the referral inside of your EHR and then make the connection to the quit line. And that you need to do a lot of computer programming to do that, and it can be expensive. So not very many providers are doing the electronic referral yet. We do have a few community health centers that have connected to the quit line through their electronic health record, and they received grant funding to do that. And so that's really exciting because we're able to test that system out, and we have several clinics that are using that now. So hopefully in the future, maybe it won't be as expensive and as difficult to do. And we're going to talk about the fax referral and the online referral in the next slides. But the connection process works this way. The clinic sends the referral to the quit line. The quit line enters that information into their system. Then they call the client, and the client can either enroll or decline. And then the outcome report is sent to the clinic so that they know what happened with that patient that they referred. So this form is the fax referral form, and it just contains patient demographics and clinic information. And one important thing to remember is always check the box that says HIPAA covered entity, because if you don't check the box that says HIPAA covered entity, you won't get your outcome report sent back to you, because legally you have to be a HIPAA covered entity for them to be able to send that information back to you. So that's one important thing. This is the online referral form, and it looks a little different, and it just depends on your clinic flow which form you might want to use. And our local health departments have staff who can come out to your clinic and help train on these ways to refer people to the quit line. And we'll talk about that in a minute too. So this is the outcome report. It's kind of hard to see, but what it will give you is information about whether the patient accepted services or declined services, if they received NRT from the quit line, things like that, so that you can follow up and be kept in the loop on what's happening with your patient. So what about setbacks? It's really hard to quit, and setbacks happen, relapse happens, and it should be viewed as a learning experience and not a sign of failure. And you can just continue to provide encouragement and support during and after treatment. Just continue to ask, advise, and connect. So are there any questions about it? I did want to talk about, while you're formulating your questions, about our local health departments, how they can come to your clinic to train on the fax referral form or help you fit that into your clinic flow. And you can find your local health department contact at tobaccofreeutah.org. So if you go to that website, I think it's there's a tab called Community, and if you hover over that tab, local health departments will come up, and if you click on that, you can go to the list of local health departments and find the contact information for the local health department for your area. So, well, thank you. And are there any other questions?
Great. We will open up the chat if anybody has any questions there. I also want to note, and we can send it to the participants after, but we do have a one-page summary of all of the resources for pregnant women. Thank you so much, Sandra, for sharing all of those resources. Do you have any other, I know that, you say you see the increase in vaping, but is it similar techniques as far as the quitting for both vaping and smoking, or I know that that's an ongoing challenge.
Yes, it is very similar techniques. And our quit line is really good about keeping their coaches up to date on vaping and all of the different things about tobacco cessation. The coaches are trained in behavioral what is it called? Oh, I'm sorry. I've lost the name of it. Motivational interviewing. That's what it is. And they're trained in all kinds of, like they learn about disparities and things like that. So they really know how to customize the intervention to the person. So yeah, they know a lot about vaping, and it is quite similar to quitting smoking.
Great, thank you. And participants, you can feel free to unmute if you have any specific questions or want to share any success stories, things that have worked in your hospital or clinic. Great, well, we will still allow folks to go ahead and share any questions in the chat. And again, appreciate all of the resources, Sandra, so much for sharing. And I will turn it over to Janet. I will stop the recording and we will have a candid discussion.
Thank you. If you have any further questions, you can just email me or let Heather know and I can get the information to you.
Perfect.
Thanks.
Thank you.